Hepatitis B and C actually has been, known as the silent infections, and the reason for that is many people don't know they are infected until they are tested much later in life when they have symptoms. So testing is very important early on because you can start treatment early, and you can manage your disease quite well if you're on treatment early. And secondly, it stops the transmission of the virus. So testing is important to protect your family and your household members if you are infected. And those people that should be tested are actually those that are at risk. People who inject drugs, people who have received unhygienic medical practices in the past, people who are on chronic dialysis, sharing equipment, and definitely those people that are showing symptoms of hepatitis or liver infection. They should be tested so that they know which viral hepatitis they have, and they should be linked to care as soon as possible so they can be managed and get the appropriate treatment for curative basis. Hepatitis B, it's commonly misconceived that HIV is more transmissible than hepatitis B. And that's not true. Hepatitis B is 100 times more infectious and transmissible than HIV. And the reason for that is that hepatitis B is a DNA virus. It has a double helix, and it makes it a tough DNA structure. So it's not easily fragile to chemical compounds. Also, the envelope that surrounds hepatitis B genome is a tight protein structure, so it makes it a very hardy virus to get rid of. So hepatitis B can actually remain on surfaces for as long as 7 days, and that is a big problem with if you're looking at prevention methods. So in households where there's a HPV positive individual, they have to make sure that they don't share personal hygiene equipment like razors and hair cutting tools and toothbrushes, for example, because this is where the blood sticks and the hepatitis B sticks on these instruments. And if somebody comes along and uses these instruments, they can contract hepatitis B from these equipment. So it's very important for cleanliness and hygiene and sterile equipments to be around the house or in the communities. So the main important function of the NICD is surveillance. And what we do is we monitor the prevalence of hepatitis B over a long period of time, and we've been doing it for years. So we can actually see whether there's a decline in the prevalence over a period of time, and we have seen that. And that has contributed to the success of the vaccination. So we have a 3-dose hepatitis B vaccine that is introduced in 1995 in the expanded program on immunization. So all children should be able to get the vaccine at their local clinics for free at 6, 10, and 14 weeks, and then there's a booster dose at 18 months. So once children have received these vaccines and all their doses of vaccine, they should be protected for life. And as a result, this brings down the prevalence of hepatitis B. So in 1995, we had a prevalence of 10% in the country, and in 2026, we are sitting at 3% in the country. So that shows the great success of the vaccination program. And the NICD data and the surveillance program that we have at the NICD has actually shown that. Over and above that, we are embarking on a genomic surveillance project, and this is with clinical collaboration, with pharmaceutical collaboration, and with our non-governmental organizations. So we're looking at how the virus, the genome of the hepatitis B virus changes over time, where are mutational hotspots, how does that translate to any kind of immune escape or drug resistance patterns, and all of these can feed into the epidemiology of hepatitis B in the country. The NICD has a surveillance function. We are monitoring prevalence across the nation for all age groups. And we relate these findings to our Department of Health. And it's very beneficial to them because then they can identify hotspots in the country as to which province or which age group needs targeting for the hepatitis B vaccination, which particular groups like HIV positive individuals or the antenatal mums probably need more input into their testing and treatment algorithms. Over and above that, at the NICD, we monitor the elimination target indicators so that we can report as South Africa as how far we are to reach our elimination targets by 2030. Community involvement is very important because that's where you get the advocacy groups advocating for hepatitis B vaccinations in young children. You can get community health workers asking people to get tested if they're at risk. You can get the input from traditional healers, community religious leaders. All of these people are integral in passing the message about hepatitis, education and awareness in communities. More so, we need champions of hepatitis B, so people who have had hepatitis B and has cleared it or has or on treatment, and they can also lend their stories to communities to engage more with people that it's a disease that can be diagnosed and it can be treated. At the moment, it's political will, funding commitment from government on the viral hepatitis elimination program. And we need to integrate testing just into HIV programs. It's a well-established program, so we can definitely integrate viral hepatitis testing into these programs. We need to look at how we can roll out rapid diagnostic testing for communities that require it, for testing at public health facilities, so we can enhance testing. We also need to look at other modalities of testing for hepatitis B, like dried blood spot testing. So in remote settings, they can always send a dried blood spot to the closest lab for testing. This will also, avail ourselves to answer questions around what is the true prevalence of hepatitis B in the country, how many people are diagnosed, how many people are treated, and definitely how we can prevent mother-to-child transmission. So these are all commitments that the government needs to put in place, and these are commitments that the government needs to fund together with other programs. The main message is on vaccination. I do advocate that all children should receive their 3 doses of the hepatitis B vaccine at 6, 10, and 14 weeks of age. Those children that missed those doses can then have a catch-up dose at 18 months of age. This vaccine will protect them for the rest of their life. It will also advocate for vaccinations across all vaccine-preventable diseases, because our vaccine coverage in the country at the moment is at an all-time low, and we're hovering around 60%. So we really do need to advocate for vaccinations of children in the EPI program. We need to make sure that these diseases can be eradicated by these vaccines that have been around for many, many years. We are currently looking at local community projects. We are engaging with NGOs on how to implement our revised guidelines. We are looking at how to improve our genomic surveillance by improving on whole genome sequencing, so we can get more answers on how the virus mutates, and if there is any mutation in particularly hotspot areas of the genome, so that these all can relate to cure therapies, vaccine responses and the overall prevalence in the country.